ಮಾನಿಟಲ್ ನಾನು ಮಗುಳನ್ನು ಕಳೆದುಕೊಳ್ಳುವುದಿಲ್ಲ ಮಿಕ್ಕಿ ಮಗಲ್ಚಿ ಅಡೇಗೆರೆ. I feel very happy to be here in that one must first start speaking in mother tongue, later other tongue, afterwards any other tongue, no problem. Because you have to convey your original thoughts. But at the same time, I know that we are in an international conference. We must speak to people language which the maximum number of people understand. I always believe that mother tongue is like eyesight. English is like spectacles. If you have eyesight, spectacles will work. If you don't have eyesight, if you wear rebar glass also, rebar se kuch aayega nahi. So, why I am insisting this is, doctors must speak to the patients in their respective language. The common people, in their local language. When you go to an expert, you do not expect him to speak in the local language. But the local, I am talking to the people in the profession, at the various levels. See to it that they communicate to the people in their respective mother tongue first. And secondly, I also have an appeal to the medical fraternity, because as a youngster in my native place in Nellur, whenever there is a health problem, we used to go to doctor. Doctors those days used to spend a lot of time with the patient. And used to make a lot of inquiries, but also used to touch the hand, then analyze, and then make a recommendation. Now the people who come to me, the complaint they make is, nowadays when you go to medical professionals, they don't touch our hand, they don't spend much time, they look to the bag and then start writing MRI, scan, this, that and all tests. After that only they speak. I'm sorry to say this, it's an international conference. Please understand the important duty of a medical professional is to interact with the patient. That gives him or her courage, confidence that doctor has understood my problem. The doctor is paying attention to my problem. The moment you write prescriptions about various tests and all, they are not that much happy. That's one thing I want to say. Second thing I want to say today is, during my student days, when I did not enter into politics, people used to say three things. Three things are important. They are like a mission. Mission, not machine. Mission. One is politics. Second is education. Third is health. These are three missions. We must carry them like a mission. Without remission, giving any remission or doing any omission, we must have passion for the nation, to the people and their problems. I don't expect the medical professionals to see to it that the patients are not charged anything. It's not possible. Doctors also, they spend a lot of money to come to this position. But they also get huge expenditure in getting all the machinery equipment, and also the personnel that are working in the medical field. They all need to be paid. But what I am saying is, that is inevitable. But don't take it as a commission or do any omission on the basis of not getting the commission. This is a pious duty. God has given you this great opportunity. God has given to me, people like me, also a great opportunity to come to politics, to occupy positions, ministerial positions. And people expect us to see them, to address their problems with sympathy and empathy. Mere sympathy will not suffice. Empathy. My dear friends, I am very happy to attend the 10th edition of the flagship annual conference of the Consortium of Accredited Healthcare Organizations, titled CAHOCON 2026, which is also said to be the first international society for quality in healthcare regional conference for South Asia here in this prestigious city, Chennai. Earlier it was known as Madras during the British period. Now it is Chennai, Chennapatnam. I'm told that this landmark 3-day event makes a significant milestone for healthcare quality in the region. I learned that over the past decade, CAHOCON has evolved into one of India's most influential platforms for advancing healthcare quality. Clinicians, hospital leaders, policy makers, quality professionals, and innovators. Seen against the backdrop of this event, it represents a defining moment in this journey, reinforcing the nation's growing leadership role in global quality healthcare. India is moving forward. Indian people, they have inherent knowledge, irrespective of whatever profession this land, this water, this air has something special. That's why a lot of Indians, they have become CEOs of the multinational companies, various companies. And also even in US, I'm told, my friends told me, of course, I stayed in US at least 10 times. They told me that even the foreigners, if they have any problem, they try to consult an Indian physician. Because they have more confidence in it. I'm not trying to differentiate between Indians and others. I'm of the view, because I was legislator, MLA, I was MP 4 times, then I was minister in the center, both for rural development as well as urban development. With all my experience, what I am suggesting is that the government should stop all other freebies. Freebies. Now, you know, wonderful promises are made that if you vote for us, give a refrigerator. Refrigerator for what? And some people are promising laptops. Some people are promising different things. What I personally feel is, with all my humble experience, don't give anything free to anybody. For the poorer people who can't afford to have food meals, for them, of course, food grains are given by Government of India. They're affordable, 2 rupees kilo. But other things you did not give. You 2 things free. I am for free of 2 things. One is healthcare. Second is education. You spend your money on that. Let the government prioritize healthcare and education. Spend money for the poorer people, provide free treatment. That is the real free service. Rather than giving this all temptations, bus free. First they said women free. And now they are latest adding and also. Don't sit at home, take the bus, go around, then go to Paris. Paris is a big place here. And then go to other market, Coimbatore market, purchase half-kilo tomatoes and come back because bus is free. What is all this happening? I am not able to understand. I am not blaming any party. I am not blaming local party or national party. No party is an exception. Every party is making promises left and right at the time of election. Do they have adequate budget? Question one. Do they have enough resources in the state? Do their budget provide for all these things? A big question. Some people may feel aggrieved why Venkaiah Naidu is speaking like this. Yes, I wanted to speak on that subject. Because I am seeing this race for freebies going on. And they're saying, Telugu as well as English also. Don't give him a fish, but try to make him to learn how to catch a fish. Don't give fish freely, because if you give fish, whatever in the afternoon, he will ask for pocha in the night. He will ask for other quality, because it's free. But teach him how to catch a fish, then he will know the difficulty and labor in that. This is what is required for the governments. Don't think I'm getting into politics. I am no more in politics. I'm retired but not tired. I go to the people, go to the colleges, go to universities, go to IITs, go to various conferences and share my thoughts because I have humble experience of nearly 55 to 60 years in public life. But what all I have learned, I want to give back to the society, to the younger generation, and also want to take feedback from the younger generation and pass it on to the government. Whether they implement it or not, that's their thing. But I feel it's my duty as a citizen of India, a responsible person who has held a number of other responsibilities to the government at the state and central level. My dear friends, while cities benefit from advanced hospitals and specialists, rural areas often struggle with the shortage of doctors, shortage of infrastructure, timely care. Technology can play a transformative role in narrowing this divide. Now we have the social media. Of course, part of it has become anti-social media. You get all nonsense, the YouTubes. The heading is something. Don't take headline as a deadline. Try to have your own line. Because when you go to the YouTube, there is nothing like a headline. This is what is happening to the social media. Part of the social media is very useful, very constructive, socially cohesive, but part of the social media is becoming anti-social. And the second thing is, now we are going to have already the human touch. I am worried because there are a lot of experts. I am worried if you rely more on AI, artificial intelligence, then the human touch get reduced. So you have to combine both the human touch as well as the intelligence, and then try to reach people to the maximum possible extent and take care of their needs. This is my advice to all the youngsters who are going into this AI. Digital literacy must be improved in rural regions. Often people in the underprivileged communities delay or avoid treatment due to financial constraints. As we tend to observe, government-supported health infrastructure and also government-supported health insurance scheme, low-cost diagnostic services and subsidized medicines can reduce this burden. The government of India, the government of different states, they must enhance the health budget. This is my appeal to all of them because as we move on, because of our changing lifestyle, food habits and all, lot of new diseases, non-communicable diseases, even cancer, even diabetic, spreading like anything. Keeping that in mind, the government, both at the central and state level, reducing or minimizing these freebies, must focus more on the health sector and then provide more to the needy people so that they get timely treatment. My dear friends, this public-private partnership can also help scale innovations while keeping costs manageable. Public-private partnership is also equally important. If you do not do it, you will not be able to get the required capital. Airports across the India, but have seen Delhi airport, but have seen Hyderabad airport. Chennai, of course, if they were hesitating in sharing the public-private partnership in various sectors, getting wonderful results. That is one way of mobilizing resources in this sector also. Health sector, education sector, and I was trying to stress, both are very, very, very important for the future of this nation. My dear sisters and brothers, I have always said, patient-centric healthcare system must prioritize the needs, dignity, and convenience of individuals. Community health workers can act as a vital link between modern healthcare systems and rural populations, building trust and awareness. It is very important for the medical people, professional people. First is how to prevent a disease. You must interact. I often suggest that on Saturday, Sunday, second Saturday, even to your family, Sunday, go to a nearby slum, go to a nearby village, go to a nearby cluster, and then try to educate the people about the preventive methods. This is very important now. It must happen because we have a huge population, 143 crore population. As I said, 55% live in the rural areas. The cities also, we have certain slums. No, India is developing and it's competing. But at the same time, these are realities. Keeping that in mind, we must take educative program. We must educate people, particularly poorer people, about the need to prevent diseases by taking needed health care. This is another important aspect I want to tell you. Then, my dear friends, this conferences like this, they must discuss, because when you come together, exchange of ideas will always improve and come with new ideas and new technologies and new methods so that people can be benefited with this pooling of ideas. Pooling of ideas is always very useful because each one of you must be having some talent. Each one of our institutions also must have talent. If we exchange ideas will enhance your knowledge. That will ultimately.
May now request a special address to be given by Dr. Ezekiel Garcia Lorio, President and Board Member of the International Society for Quality in Healthcare.
Most of you are familiar with ISPA from our previous participation in this conference and around India in the last years. But I would like to mention that what we are is what we are the global convener for quality of healthcare since 1985, when ISPA was created. What we do is we network, we give voice, as the Prime Minister, as a former Vice President said, we give voice to people, we disseminate knowledge, and we try to translate this into action. What we're trying to do and how we do it for programs. You will see that in the exhibition hall, our colleagues from Ireland will share with you what we do as a membership society, what we do providing fellowships to some of you that have already taken this program in the past and are continuing hopefully in the future, and more can join. Then we run global conferences. And again, I'd like to acknowledge our colleagues from CAHO, since this is the first regional Southeast conference for ISQA in its history, so it's important that we celebrate that. Sam is always applauding, so we need to. We also try to disseminate knowledge through educational programs. And as we all know, also ISQA is the accreditors of the accreditors. Every accreditation program around the world, it's certified by ISQA, and that provides consistency and reliability, as we've been here before, to every accreditation program around the world. Also, we are quite keen to disseminate new knowledge for research, and we have established the first journal in quality of healthcare many years ago, the ISQA Journal, and ISQA Communications recently. And finally, we network through communities of practice, and that gets us to what's happening now around the world, where we have community of practices in Africa, Asia with CAHOCON and ASQA, and also in Latin America. So again, we are a convener, we are a safe platform from any one of you that would like to be connected to your peers that are working in quality of care. You can do so as a person, as an individual, and you can do so as an institution. We have 112 institutions we are part of ISQA, like CAHO and others. Finally, why we do it? We just heard about the importance of delivering the right care to people around the world. And ISQA, it's there because quality is the ultimate goal. We need to do more.
Consortium of accredited organizations, healthcare organizations. So இந்த காஹோ அப்படின்றது ஒரு ஹெல்த் கேர் குவாலிட்டிக்காக தொடங்கப்பட்ட ஒரு ஆர்கனைசேஷன். ஸோ இதில் வந்து இந்த வருஷம் சென்னையில் வந்து நம்ம 10வது வருடமாக இந்த கான்ஃபரன்ஸ் நடத்தி கொண்டிருக்கின்றோம். ஸோ இந்த வருஷம் முக்கியம் என்னன்னா இதில் வந்து இஸ்குவா அப்படின்றது இன்டர்நேஷ்னல் சொசைட்டி ஆஃப் குவாலிட்டி இன் ஹெல்த் கேர் அவங்களோடய சேர்ந்து இந்த ஏஷியன் கான்ஃபரன்ஸை இங்கே வந்து நம்ம நடத்திட்டு இருக்கிறோம். CAHOCON அப்படின்றது ரொம்ப ஃபேமஸாக இப்போ வந்து இதில் 2500 பேருக்கு மேலே இதில் வந்து இன்றைக்கு கலந்து கொண்டிருக்கிறார்கள். இதில் பல வகையான மருத்துவர்கள், மருத்துவமனை ஊழியர்கள், மருத்துவமனை தலைவர்கள் எல்லாருமே வந்து கலந்து கொண்டு சிறப்பிச்சிட்டு இருக்கிறாங்க. இதில் நிறைய ஸ்பீக்கர்ஸ் வந்து இந்தியா முழுவதும் வராங்க. இந்தியாவிலேருந்து வெளிநாட்டிலேருந்து இந்த ஸ்பீக்கர்ஸ்லாம் வந்து இந்த மாநாட்டை வந்து சிறப்பிச்சிட்டு இருக்கிறாங்க. ஸோ இதில் வந்து இந்த காஹோடைய தலைவர், ஆல் இண்டியா தலைவர் டாக்டர் விஜய் அகர்வால் அண்ட் ஜெனரல் செக்ரட்டரி திருமதி டாக்டர் லல்லு ஜோசப் அவர்கள். டாக்டர் விஜய் அகர்வால் இப்போ சொல்லுவாங்க.
So our organization was found in 2012-13. Our organization was created in almost 2013 with the aim to bring all the hospitals together to promote patient safety, quality and accreditation. Please understand that we are a not-for-profit body, and with the sole aim to see that the medical harm that can happen to a patient should not happen. This is concept of harm to a patient. You may understand that our own actress, Madam Shri Devi, her mother in 1998 was operated in the best hospital in United States, was operated on the wrong side of the brain. Instead of being operated on the left side, she was operated on the right side. She became vegetative and died within 1 year. Now that kind of incident is not anecdotal. It happens all the time that errors can happen. These errors are not deliberate. They are happening because of the errors in communication, because of coordination, because we are now like a team. So therefore, there are lot of possibilities of a harm to a patient. For controlling these errors, there have been the system of accreditation. But accreditation also has not helped. So that is where a body like CAHO has come, which is trying to motivate people in the hospitals, all the people, not only doctors and nurses, engineers, pharmacists, dietitians, rehab specialists, CEOs, housekeeping, everybody, infection control, and therefore motivating them that we should all work towards promoting patient safety. This is our annual conference that we do every year. This is the 10th annual conference which is happening in Chennai, and we are very proud of the kind of response that we have received in Chennai. So I'll be very happy to take, but I think
சார் சொன்னது மாதிரி இது கன்சார்டியம் ஆஃப் அக்ரெடிட்டட் ஹெல்த் கேர் ஆர்கனைசேஷன்ஸ். த மெயின் ப்ராப்ளம் ஹாஸ்பிட்டல்ஸில் வர்றது என்னன்னா, லாட் ஆஃப் எரர்ஸ் கேன் ஹேப்பன். மெடிகேஷன் தப்பாக கொடுத்துடலாம், தப்பான சர்ஜரி பண்ணிடலாம், இல்லைனா இன்ஃபெக்ஷன். நீங்கள் போகிறது ஒரு ஆர்த்தோபெடிக் சர்ஜரிக்காக இருக்கும், திருப்பி வர்றது வேறு அடிஷ்னல் இன்ஃபெக்ஷனோட வரலாம். இது எல்லாத்தையும் எப்படி ப்ரிவென்ட் பண்ணுறது அப்படிங்கிறது தான் எங்களோட நோக்கம். நாங்கள் வந்து ஒரு நாட் ஃபார் ப்ராஃபிட் சொசைட்டி. ஆனால் இந்த 10 வருஷத்துல ரொம்ப பெருசாக வளர்ந்துட்டோம். எதனாலனா, இந்த சிஸ்டம்ஸ் எல்லாத்தையும் இம்ப்ளிமெண்ட் பண்ணுறதுக்கு எல்லா ஹாஸ்பிட்டல்ஸ்க்குமே ஹெல்ப் தேவைப்படுது. அந்த ஹெல்ப்பை தான் நாங்கள் ப்ரொவைட் பண்ணுறோம். நாங்கள் எல்லா ஹாஸ்பிட்டல்ஸையும் சேர்த்து கொண்டு வந்து ஒவ்வொரு ஹாஸ்பிட்டல்லேருந்து என்னென்ன கற்றுக்கலாம், அடுத்த ஹாஸ்பிட்டல்ஸ் என்ன கற்றுக்கலாம் அப்படிங்கிறத இந்த கான்ஃபரன்ஸ் மூலமாக பண்ணுறோம். இது ஒன்லி ஒன்ஸ் அ இயர் கிடையாது. த்ரூ அவுட் த இயர் அக்ராஸ் இந்தியா எல்லா சிட்டிஸ் டவுன்ஸ்ல என்னைக்குமே டெய்லி ஒவ்வொரு ஆக்டிவிட்டி நடந்துட்டே தான் இருக்கும். ஸோ எப்படி ஒரு சர்ஜிக்கல் சேஃப்டி செக்லிஸ்ட் பண்றது, எப்படி அதை யூஸ் பண்றது, எப்படி ப்ரிவென்ட் பண்றது, அதை வச்சு தான் நாங்கள் பண்ணிட்டு இருக்கோம். இந்த வருஷம் வந்து எங்களுக்கு வெரி ப்ரவுட் மொமெண்ட். இன்டர்நேஷனல் சொசைட்டி ஃபார் குவாலிட்டி அவங்க தான் வந்து அக்ரெடிட்டேஷன் பாடிஸ் எல்லாத்தையுமே அக்ரெடிட் பண்ணுவாங்க. அவங்களோட ஃபர்ஸ்ட் ரீஜனல் கான்ஃபரன்ஸ் இன் சவுத் ஈஸ்ட் ஏஷியா வந்து இந்த கான்ஃபரன்ஸை அனௌன்ஸ் பண்ணியிருக்காங்க. நம்மளோட சிஇஓ ஆஃப் இஸ்குவா டாக்டர் காஸ்டன் இங்க வந்திருக்காங்க. அவங்களோட 7 பேர் அக்ராஸ் த குளோப்ல இருந்து வந்திருக்காங்க. ஸோ எங்களுக்கு இது ஒரு பெரிய பார்ட்னர்ஷிப். வெளிநாட்டுல என்ன நடக்குது அது எல்லாத்தையும் கூட இங்க நம்மளால கொண்டு வர முடியுது. இப்ப இந்த ஏஐ எல்லாம் வந்ததுனால அதோட பெனிஃபிட்ஸ் என்ன, அதோட டிராபேக் என்ன, அதனால பேஷண்டோட நம்மளுக்கு இருக்கிற டச் போயிடுமா, அதெல்லாம் பத்தி தான் டிஸ்கஸ் பண்றோம் இந்த வருஷம். அதோட பேஷண்ட் சேஃப்டி ஏதாவது ப்ராப்ளம் இருக்குமாங்கிறதா மெயின் தீமா எடுத்து பண்றோம். என்ன கொஸ்டின்னாலும் ஆன்சர் பண்றோம்.
Want to say a couple of
Come this side.
come on the side.
Yeah, my name is Carsten Engel. I am the CEO of ISQA, the International Society for Quality in Healthcare. We are based in Dublin, Ireland, and we have been a world convener for quality and safety in healthcare since 1985. And we work through a number of programs. One of them is accrediting the accreditors. Another one is a conference, and also we have education programs. It's very important for us to have partnerships like the partnership we have with CAHO, and we are proud to be part of the first regional conference in Southeast Asia. It is important for us because we want to reach out to everyone, to every corner of healthcare all across the world, and the best way to do it is to partner with strong regional organizations like CAHO. And we are very impressed with what we are seeing here. We are very impressed with the way in which CAHO has been able to build a movement, to engage with a lot of people, from CEOs to people working at the ground level in hospitals, and have created and guided a huge movement of commitment to improve the quality of healthcare for everyone.